Welcome, everyone. Thank you for joining us for Men's Health 101. My name is Dr. Michelle Gamble. Before we go any further, I want to tell you a little bit about myself. I am a health and wellness expert, and I understand the importance of men's health. I'm also humbled to have the privilege of supporting and educating people such as yourself through prevention. So let's get started. First, a little disclaimer. Please remember that the information in this presentation is not intended to replace a one-on-one relationship with a qualified medical professional, and it is not intended as medical advice. This presentation is intended as a sharing of the knowledge and information that I've gathered from my research, as well as the research of those who have contributed to this presentation. I encourage you to make your own healthcare decisions based upon your research and in partnership with your qualified healthcare team. Well, the fact that men go to the doctor less than women may account for men's shorter lifespan. In fact, when it comes to seeking care, most men will brush off their annual visits. But why? Many men report vague issues like a busy schedule. However, there may be deeper issues at hand, including having a macho attitude, where you feel that you can miss a couple of visits to the doctor, and studies reveal a link between self-reported masculinity and resisting routine examinations. Perhaps there's a fear. Recent studies reveal 20% of men report fearing a poor diagnosis as the main reason for getting regular checkups. And then there's the possibility of discomfiture. Another main reason why many men fail to be enthusiastic about their annual visits is because they're uncomfortable with the exam, in particular, the rectal exams and other invasive tests that are apt to give men hesitation about seeking preventative care. The bottom line is there is certainly a link between masculinity and vulnerability, and many men wait until symptoms are persistent before seeking medical care. This can be an unfortunate mistake, as many conditions are preventable or treatable when detected early. Let's look at some of those screening options that are available for early detection. As the saying goes, an ounce of prevention is worth a pound of cure. Prevention is the most important facet of maintaining health. Let's take a look at some of these chilling statistics. Only 3 out of 5 men get a yearly checkup. 12% of men over 18 are in fear or poor health. 40% of men go to a doctor when they fear a chronic medical condition. And 34% of men over the age of 20 are either overweight or obese. Now, you may not be aware of this, but annual health checkups can help early detection of heart disease, cancer, which are the leading causes of death among men. Screenings are even available for blood pressure, cardiovascular disease, coronary artery disease, prostate cancer, colon cancer, and so much more. You may already know that heart disease is the leading cause of death for men in the United States. But did you realize that heart disease is responsible for as many as 1 in every 4 male deaths? High blood pressure, high LDL cholesterol, and smoking are key risk factors for heart disease. And according to the CDC, about half of Americans have at least one of these 3 risk factors. Additional factors putting men at higher risk for heart disease include diabetes, being overweight or obese, poor diet, physical inactivity, excessive alcohol use, and more. The best way to protect against heart disease is through regular screenings of important risk factors, such as checking your blood pressure and cholesterol annually. Nearly 50% of all men over the age of 50 have PIN. The tiny changes that occur in the shape and size of the prostate gland cells, known as prostatic intraepithelial neoplasia, PIN. Prostate cancer can be successfully treated if it is diagnosed before metastasis, but is more dangerous if it spreads more commonly to the bones. Initial screening can be a simple blood test called PSA, prostate-specific antigen. If an abnormality is found, further examinations can be requested, including a digital rectal exam or a biomarker testing, including blood, urine, and body tissue samples. Risk factors include the following: being at least 50 years old or older, at least 60% more common and 2 to 3 times more deadly among Black men and non-Hispanic white men. A diet that is high in red meat or high fat and dairy products, obesity, and exposure to Agent Orange. Colorectal cancer is a collective term that includes both colon cancer and rectal cancer. It is among the leading cause of death among American men and women. The American Cancer Society recommends a colorectal cancer screening beginning at age 45 for men. Risk factors include having an age that is 50 years or older, anyone in your family history who has been screened and identified with cancer previously. Already having cancer also increases the risk of having cancer again. Inflammatory bowel disease, drinking more than 2 alcoholic drinks per day, obesity, smoking, diabetes, having a high-fat diet with fats coming from mostly meat. Thankfully, colorectal screening is usually preventable, with screening which should start around the age 45. Options for screening include stool-based tests and other exams such as colonoscopies. Older men are twice as likely to develop melanoma as women of the same age. In fact, by age 80, men are 3 times more likely than women in that age group to develop melanoma. Men are also 2 to 3 more times likely to get non-melanoma basal cell and squamous cell cancers than women. One of the main reasons behind the difference may be due to the fact that men, knowing less about skin cancer, and the fact that men are less likely to use sunscreen. Additionally, men have both thicker skin with less fat beneath, possibly making men's skin more likely to be damaged by the sun's ultraviolet rays. Melanoma is the most serious form of skin cancer. However, early detection is key to treatment. Risk for hypertension or high blood pressure increases with age. Would you believe that 1 in 3 Americans have high blood pressure? In fact, over half of all Americans age 60 and older have it. And over a lifetime, the risk of developing high blood pressure becomes as high as 90%. Risk in men increases with age and begins to climb when men hit around age 45. High blood pressure is especially dangerous because people can have it for years without knowing, which is why regular screening is so important. Factors that lead to high blood pressure include things such as a high salt diet, low potassium, too much alcohol, lack of physical activity, obesity, diabetes, and having a family history of hypertension. The screening is simple, as high blood pressure is usually diagnosed using the familiar blood pressure test that involves a cuff wrapped around the upper arm. Normally, blood pressure is considered to be healthy if it is around 120 over 80. Hypertension is defined as a systolic reading between 120 and 129, and a diastolic reading lower than 80. Hypertension is defined as high blood pressure of 130 over 80 or higher. Cholesterol is needed in the body to perform vital functions such as the production of hormones, vitamin D, and bile acids that help you to digest fats. However, too much is not so good. There are two types of cholesterol: LDL, low density lipoproteins, and HDL, high density lipoproteins. LDL is responsible for blocking arteries through a buildup of fatty deposits called plaque. This plaque buildup can block blood flow to the heart muscle, reducing its oxygen supply, leading to stroke or heart attack. HDL is the quote unquote good cholesterol, which helps to remove LDL from the blood and eventually from the body. Risk factors for high cholesterol include a diet that is high in saturated fats, trans fats, and or processed foods that are high in carbohydrates, being overweight or obese, diabetes, as well as lack of exercise. Annual blood testing will screen for high cholesterol and should be started at age 35 for men. Did you know men develop diabetes slightly more often than women do? In fact, according to the Centers for Disease Control and Prevention, 14% of adult men in the United States have been diagnosed with diabetes, in comparison to 11% of women. General symptoms of prediabetes include skin infections that don't heal, excessive tiredness, poor dental health, inability to attain or sustain an erection, overactive bladder, blurred vision, and other symptomology. Men generally don't seek attention until they have full-blown diabetes, unfortunately, and this is a huge mistake. Early detection and lifestyle changes can make it so much easier and quicker to reverse prediabetes. Indeed, the American Diabetes Association recommends that all patients undergo diabetes screening at 3-year intervals beginning at age 45, especially people who are overweight or obese. When multiple risk factors are present, screening should be done at an earlier age more frequently. Fasting blood plasma glucose testing is usually used for screening. Indeed, I encourage people to be tested from teenagers because the fastest growing group of diabetics in our nation are actually our young people. Now, glaucoma is a serious condition that can lead to permanent blindness within a few years without treatment. There are typically no early symptoms. However, only an eye doctor can diagnose and treat glaucoma before long-term visual loss happens. This is why you should get your complete eye exam done regularly. Eye tests for glaucoma are based on age and personal risk. Under the age of 40, every 2 to 4 years. When you get older, I would suggest every 1 to 2 years. And if you are 65 and older, every 6 to 12 months. Testosterone is the primary sex hormone in men and plays various roles in the body. Levels of testosterone gradually drop in men as a natural part of aging. The decline may start in the late 30s with a reduction of 1% a year, starting at age 45. 1 in 4 men between ages 30 and 79 experience low testosterone levels. Testosterone deficiency in men is associated with several serious health problems, including musculoskeletal problems such as osteopenia and sarcopenia, obesity, unhealthy cholesterol levels, type 2 diabetes, and cardiovascular disease. Screening for testosterone levels is not quite part of the normal routine. However, if you experience the following, you may want to request a blood test to check your levels. Increased body fat, especially around the abdominal area, decreased strength or mass of muscles, fragile bones, decreased body hair, swelling and tenderness in the breast area, hot flashes, increase in fatigue, and effects on your cholesterol metabolism, low sex drive, and difficulty with erections. Here's a quick overview of the screening tests for men and women. Sorry, for men. This is a men's health workshop, right? For men and when they need them. We suggest annual screenings for prostate cancer starting at 50, colorectal cancer starting at 45, skin cancer, blood pressure, cholesterol starting at 35. We suggest diabetes screenings. Well, I suggest diabetes screenings every year because it is that critical. Glaucoma screenings under the age of 40 every 2 to 4 years, and over the age of 40 every 1 to 2 years. If you're over 65, every 6 to 12 months. Now, let's talk about what we can do, because lifestyle factors such as smoking, poor diet, unhealthy weight, inactivity, overuse of alcohol, and stress are linked with an increased risk of negative health consequences. It is also important to be aware that several motor vehicle accidents are higher among men, so it is important to be safe, such as wearing a seatbelt and following the speed limit. Don't drive while under the influence of substances or while sleepy. One last thing. Suicide is also another leading men's health risk and is attributed to depression. Anyone feeling sad or worthless or in loss of interest in normal activities should talk to a doctor right away. Many risk factors associated with negative health outcomes are manageable through lifestyle and behavioral changes, and the rest of the class will be dedicated to discussing strategies to change poor health habits in order to lower the risk of diseases mentioned. The CDC reports that cigarette smoking is the leading preventable cause of death in the United States. Smoking increases the risk for coronary heart disease by 2 to 4 times, for stroke by 2 to 4 times, and for men developing lung cancer by 25 times. In fact, smoking causes stroke and coronary heart disease, damages blood vessels, can make them thicken and grow narrower, and causes most cases of lung cancer, plus other cancers almost anywhere in the body. The good news is that quitting smoking cuts cardiovascular risks greatly. In fact, in just 2 to 5 years after smoking, your risk for stroke may reduce to about that of a non-smoker. Plus, if you quit smoking, your risk for cancers of the mouth, throat, esophagus, and bladder drop by half within 5 years. In 10 years after you quit smoking, your risk of lung cancer drops by half. Are you struggling? We encourage you to seek resources that are available throughout the internet and through your local health department. Most health and wellness advocates agree that diets emphasizing fresh, whole food ingredients and minimizing processed foods are superior for overall wellness. A few tips include limiting or avoiding animal products, focusing on including vegetables, fruits, whole grains, legumes, and seeds and nuts, and excluding refined foods such as added sugars, white flour, and processed oils. Let's talk a moment about the BMI, body mass index, which is calculated from weight and height. You are considered underweight if your BMI is below 18.5, whereas if you are between 18.5 and 24.9, that is considered normal. 25.5 to 29.9 is overweight, and anything over 30 is considered obese. Please note that this is modified by people who have massive amounts of musculature, which will skew these percentages. According to the CDC, men who are obese are at higher risk for heart attacks, strokes, type 2 diabetes, depression, and many other ailments. That is why it's important to manage your weight for disease prevention. Therefore, eating better and being physically active are the main keys to achieving a healthy BMI. Physical activity, without a doubt, is the key to health and longevity. The U.S. Department of Health and Human Services provides science-based guidelines to help children and adults in the United States improve their health through appropriate physical activities. Recommendations state that adults should do at least 150 minutes, otherwise known as 2 hours and 30 minutes a week, of moderate intensity or 75 minutes a week of vigorous intensity aerobic activity, or an equivalence of a combination of moderate and vigorous intensive aerobic. Aerobic exercise could be performed in episodes that are about 10 minutes or more, and it should be spread out throughout the week. For additional health benefits, adults should increase their activities with other types of exercise, such as muscle strengthening activities that are moderate or high intensity and involve all the major muscle groups on 2 or more days a week for optimal health outcomes. Drinking alcohol should be done in moderation. For men under 65, no more than 2 drinks a day should be consumed, and men over 65 should limit daily intake to no more than 1 a day. Did you know that alcohol intake has been linked to the risk of various types of cancer, such as liver cancer, and appears to increase with the amount of alcohol you drink and the length of time you've been drinking regularly? Too much alcohol can also raise your blood pressure as well as your blood glucose levels. Now, last but not least, stress is a major contributor to many of the poor health outcomes that we've discussed today. Stress is bad for the heart, can lead to poor eating choices, which can cause fat accumulation around the belly, and type 2 diabetes. Stress is also linked to mental health concerns as well as anxiety and depression. It's important to include stress-reducing activities such as breathing exercises and physical activity into your daily routine. Once again, thank you for joining us for this presentation. Feel free to contact us if you have any questions, concerns, or comments. At our website, www.sankofahealing.com, you can get more information about our various health and wellness programs. You can also feel free to email us and/or phone us. Once again, congratulations on taking a step in the direction of improving your overall health and wellness.